that physical therapy can help. I can think of two patients. So the first patient was actually, the mom came to me saying that her son has been coming home from school every day, near in tears, requiring like hot baths because his muscles are so sore. He's like almost crying every day after school. That went on for a year. She goes to the doctor's going to prescribe going to a neurosurgeon and an orthopedic surgeon, and she was like, well, he doesn't need surgery, but something's wrong. So she ends up meeting me. I show her how to do a couple of stretches. He's been pain free ever since he did them. So how wonderful is that you get to give a mom some peace because you get rid of that anxiety that your child is just hurting and you don't know what to do. I also met a guy that came into the clinic one day and he asked what the process was to get carpal tunnel surgery. So he came in because he couldn't feel his hands, and he does a lot of manual stuff with his hands all day, so twisting things all day. But he was for sure that he was going to have carpal tunnel surgery. He did the eval, and at the end of the evaluation, he could feel his hands and grip almost at full strength. So he stopped him from having to have surgery on both of his forearms just by doing a couple manual techniques. And he was completely sold, so he did a full round of therapy, and by the time he was done, he knew how to treat himself, and he wasn't thinking about going to the doctor for surgery. So those are kind of the things. Hip flexor strains, somebody who likes to do kickboxing and all of a sudden that front hip is killing you. You do a couple stretches, we work on some joint mobilizations, and now you're kicking that heavy bag again without any pain. So those are kind of the benefits for physical therapy.